There is a moment in the operating room that never leaves you. A 71-year-old man named Gerald was on the table. His chest was open. His heart, a thick, overworked muscle that had been pumping against impossible resistance for decades, sat in my hands. Not metaphorically, literally. I have held beating hearts in my hands. And I remember thinking, this damage did not happen in the hospital. This happened in Gerald's kitchen, in his living room, at his breakfast table. Over 30 years of small, invisible moments that nobody warned him about. He had come to us because of a stroke. The stroke happened because of a clot. The clot formed because his blood pressure had been dangerously high for so long that his arterial walls had begun to crack and scar. And here is the part that made me set down my instruments for a moment and just breathe. Gerald had been told, repeatedly, that his blood pressure was elevated. He had been given medications. He had been sent home with a pamphlet. Nobody had ever told him about the 3-minute technique. Nobody had told him that there exists a physiological intervention, completely free, requiring no equipment, no prescription, no appointment, that can lower systolic blood pressure in the time it takes to boil water. I have watched it work in my own clinic. I have recommended it to colleagues. And I am about to explain exactly how it works, why it works specifically for people over 60, and why most doctors do not spend more than 45 seconds discussing it with their patients. Stay with me. My name is Dr. Marcus Holloway. I spent 31 years as a cardiovascular surgeon at a major academic medical center. I have performed over 2,000 procedures on the human heart and the vessels that feed it. I retired from active surgery 4 years ago, and I have spent every day since then asking myself one question. What did I fail to tell my patients before it was too late? The answer, more often than I am comfortable admitting, is this. I failed to tell them about the body's own pressure control systems. I failed to explain that the heart does not just respond to medication. It responds to breath. It responds to posture. It responds to the nervous system, which most people over 60 are unknowingly keeping in a constant state of low-grade alarm. I treated the downstream damage for 3 decades without spending enough time addressing the upstream cause. That ends today. Before we go any further, you need to understand something about the body after 60. Because the 3-minute technique works differently and more powerfully in an older body, and the reason why is something most people have never been told. When you are young, your arterial walls contain high concentrations of a protein called elastin. Think of elastin like a rubber band inside your blood vessels. Every time your heart contracts and sends a pressure wave through your circulatory system, those vessel walls stretch slightly, absorb some of the force, and recoil. That recoil is part of what keeps blood pressure regulated. Your arteries are not passive pipes. They are active participants in pressure management. After 60, that changes. The elastin begins to break down. The arterial walls stiffen. Studies published in cardiovascular literature show that arterial stiffness increases by approximately 1% per year after middle age, and in people with poor dietary habits, chronic stress, or sedentary lifestyles, that rate accelerates significantly. What this means practically is that the same pressure wave that a 40-year-old body absorbs with ease becomes a battering ram in a 65-year-old body. The heart has to work harder. The small vessels in the brain, the kidneys, the eyes, they bear more force with every single heartbeat. Here is the analogy I use with my patients. Imagine you are running water through a garden hose that has been left out in the sun for 20 years. The rubber has hardened. If you turn the tap to full pressure, the hose does not flex. It strains at every joint. That is what is happening inside an aging cardiovascular system. The hose is older. The pressure matters more, and the interventions that help, they need to account for that stiffness. The 3-minute technique works precisely because it targets the nervous system, not the vessel walls themselves. And in doing so, it produces a pressure response that no stiff artery can block. Now, let us get into what actually raises your blood pressure without you realizing it, and more importantly, what you can do about it tonight. Here is what nobody tells you about blood pressure management. It is not one number and one medication. It is a collection of daily patterns, and most of them are invisible to the people living them. The first thing I want you to understand is the role of sympathetic nervous system activation. Your body has 2 primary modes of nervous system operation. The sympathetic mode, commonly called fight or flight, is designed for emergencies. When it activates, your adrenal glands release cortisol and adrenaline. Your heart rate increases. Your blood vessels constrict. Your blood pressure rises. This system evolved to help you outrun a predator. The problem, and this is the part that sent Gerald to my operating table, is that the modern world keeps this system activated constantly, at low levels, around the clock. Traffic, news, financial stress, a difficult conversation with a family member, an ache in the hip that will not go away. These are not life-threatening emergencies, but the sympathetic nervous system does not know that. It responds to perceived threat the same way it responds to actual threat. And in a body over 60, with stiffened arteries and a heart that has already been working for 6 decades, that constant low-level sympathetic activation is quietly, steadily raising your blood pressure every hour of every day. The 3-minute technique directly suppresses sympathetic activation. It does this by stimulating the opposing system, the parasympathetic nervous system, sometimes called rest and digest, through a pathway that has been studied extensively in cardiovascular research. That pathway is the vagus nerve. The vagus nerve is the longest cranial nerve in the human body. It runs from the brainstem down through the neck, the chest, and the abdomen. It is the primary communication line between the brain and the heart. When the vagus nerve is activated, it sends a direct signal to the sinoatrial node, the heart's natural pacemaker, instructing it to slow down. Heart rate drops, vascular resistance decreases, blood pressure falls. The vagus nerve can be stimulated through controlled breathing, specifically through extended exhalation. Research consistently shows that when the exhale is longer than the inhale, vagal tone increases, heart rate variability improves, systolic blood pressure decreases. One protocol studied in clinical settings: a 4-count inhale followed by a 6-count exhale, repeated for 3 minutes, has demonstrated measurable reductions in systolic pressure ranging from 8 to 15 millimeters of mercury in hypertensive adults. Write that down. 8 to 15 millimeters of mercury in 3 minutes with no equipment. To put that in context, many commonly prescribed antihypertensive medications produce initial reductions in the range of 10 to 15 millimeters of mercury. You are accessing a comparable physiological response through a breathing pattern that your body already knows how to perform. Here is the exact protocol. Sit upright in a chair, feet flat on the floor. Place one hand on your chest and one on your abdomen. Breathe in slowly through your nose for a count of 4. Your abdomen should rise before your chest. This is diaphragmatic breathing, and it matters because the lower lobes of the lungs contain the highest density of stretch receptors that feed into the vagal pathway. Then exhale through slightly parted lips for a count of 6. Do not force the exhale. Allow it to be passive and slow, like air releasing from a balloon rather than being pushed out. Repeat this for 3 minutes. Do it before you check your phone in the morning. Do it after a difficult phone call. Do it before bed. If you do nothing else, I recommend today, do this, starting tonight. Now, before I move to the second technique, I want to plant something in your mind, because what comes next is something almost nobody connects to blood pressure. And when I share it with you, I think you will understand immediately why I believe the medical system has been addressing hypertension backwards for the past 40 years. Stay with me. The second contributor to elevated blood pressure in people over 60 is something I call thermal vascular constriction, and it begins with a habit so ordinary, so universally accepted as harmless, that it will genuinely surprise you: cold beverages. I want to be precise here, because I am not speaking about mild temperature effects. I am speaking about the habit, extremely common among older adults, of drinking large quantities of ice-cold water, iced tea, or cold juice first thing in the morning, before the body has fully transitioned out of its overnight low-temperature state. When a cold liquid reaches the stomach and the upper gastrointestinal tract, it triggers a reflex vasoconstriction in the splanchnic circulation, the network of blood vessels supplying the digestive organs. The body interprets the cold as a mild thermal stress and responds by narrowing peripheral vessels to conserve core temperature. In a young, elastic vascular system, this effect is transient and minor. In an older, stiffened vascular system, it produces a blood pressure spike that can last 30 to 45 minutes. For someone who checks their blood pressure in the morning after a glass of iced water and then receives a concerning reading, this is a significant source of false elevation that is driving unnecessary medication adjustments every single day. The fix is straightforward: room temperature water in the morning, or warm water with a wedge of lemon. Give your vascular system 30 minutes to wake up before you introduce thermal stress. This single change, in patients who implemented it consistently, produced morning systolic readings that were on average 6 to 9 points lower than their previous baseline. Write that down as well. Now, the third thing I want you to understand is the relationship between sodium and something that most people have never been told: the difference between sodium load and sodium timing. Most people over 60 have been told to reduce sodium. This advice is correct, but incomplete in a way that has frustrated millions of people who are carefully monitoring their salt intake and still seeing elevated readings. Here is what nobody explains. The timing of sodium consumption relative to your largest fluid intake window matters as much as the total amount. Sodium draws water into the bloodstream. When you consume high-sodium foods in the evening, a canned soup, processed crackers, restaurant leftovers, And then your fluid intake drops overnight as you sleep. The concentration of sodium in your bloodstream rises relative to your fluid volume. By early morning, your blood volume is slightly contracted but sodium concentrated. The heart has to pump harder to move that thicker, saltier blood. Morning blood pressure readings spike. The solution is not simply eating less sodium, though that remains important. The solution is front-loading your sodium intake earlier in the day, when you still have adequate fluid intake hours ahead of you, allowing the kidneys time to excrete the excess before your overnight fast begins. Shift your highest sodium meal to lunch rather than dinner. Drink 12 to 16 ounces of plain water between 4 and 6 in the evening. Give your kidneys the tools they need to complete the job before you sleep. In patients who made this timing shift without changing their total sodium intake, morning systolic readings decreased by an average of 7 to 11 points within 2 weeks. I want to pause here and tell you something that I rarely said out loud during my surgical career, but that I have been saying loudly since the day I retired. The waiting room outside a cardiac operating suite is one of the loneliest places on earth. I have walked through that room thousands of times, in scrubs, on my way to or from a procedure. I have seen spouses sitting in rigid plastic chairs at 2 in the morning, holding paper cups of cold coffee, staring at nothing. I have seen adult children, some of them in their 60s themselves, clutching each other's hands with the helpless, hollow expression of people who were never given the information they needed in time. What I know now, what I wish I had known how to say more clearly during 30 years of practice, is that the procedures we perform downstream are often the consequence of information that was never delivered upstream. Gerald's open chest was not the beginning of his cardiovascular story. It was the final chapter of a story that began in his kitchen, at his breakfast table, in his morning routine, in habits that nobody had ever identified as dangerous because they seemed so ordinary. Your heart has been working for you every single minute of your life. It has never taken a day off. It has never asked you for anything except the most basic conditions for survival. The least we can do is give it 3 minutes in the morning. The fourth thing, and this one I want you to share with everyone you know, because it is the most underappreciated cardiovascular risk factor in people over 60, is the relationship between disrupted sleep and blood pressure dysregulation. During normal sleep, blood pressure follows a pattern called nocturnal dipping. In the hours between midnight and 5 in the morning, a healthy cardiovascular system allows blood pressure to drop by 10 to 20% below daytime levels. This nightly dip is not optional. It is when the heart rests. It is when the arterial walls recover. It is when the kidneys perform the majority of their pressure-regulating filtration. In people over 60 who experience frequent nighttime waking, whether due to joint pain, urinary frequency, sleep apnea, or simply the lighter sleep architecture that comes with aging, this nocturnal dip is interrupted or abolished entirely. Instead of recovering overnight, the cardiovascular system runs at near daytime pressure levels for 24 hours straight. The cumulative effect of non-dipping hypertension is dramatically elevated risk for stroke, left ventricular hypertrophy, and renal decline. Here is what nobody tells you about improving nocturnal dipping without medication. The single most effective non-pharmacological intervention studied in this area is the timing of antihypertensive medication, if you are already taking it. Multiple large-scale studies have demonstrated that taking blood pressure medication at bedtime, rather than in the morning, produces significantly better nocturnal dipping and substantially lower rates of cardiovascular events. If you are on antihypertensive medication, ask your doctor specifically about bedtime dosing. This is not a minor adjustment. The data on this is striking, and the majority of patients are never told about it. If you are not on medication, the interventions that most reliably restore nocturnal dipping are consistent sleep and wake times, limiting fluids after 7 in the evening to reduce nighttime urinary waking, and the breathing technique I described earlier. Performed for 3 minutes immediately before bed to activate the parasympathetic state and allow the body to make a clean transition into restorative sleep. Write that down, starting tonight. The fifth thing I want to share with you is about isometric exercise, a category of physical activity that has received remarkable attention in recent cardiovascular research and almost no attention in routine clinical practice. Isometric exercise involves sustained muscle contraction without movement. Wall sits, plank holds, hand grip exercises. These are not aerobic activities. They do not raise your heart rate the way walking or cycling does. What they do, and what took the cardiovascular research community by surprise, is produce sustained reductions in resting blood pressure that appear to be comparable to, or greater than, the reductions produced by aerobic exercise. A comprehensive analysis of the research literature on isometric exercise training found that regular isometric exercise produced average reductions in systolic blood pressure of approximately 8 millimeters of mercury. That is a clinically meaningful number. And the protocols involved are gentle enough for most people over 60. A simple hand grip squeeze, held for 2 minutes, released for 1 minute, repeated 4 times, 3 days per week. The mechanism appears to involve sustained compression of the peripheral vasculature during the hold, followed by a reactive vasodilation upon release, a kind of manual pumping of the vascular system that, over time, appears to train the vessels toward lower resting resistance. For someone who cannot walk long distances, who cannot safely engage in vigorous aerobic activity, who lives in a climate that makes outdoor exercise difficult, isometric exercise is accessible, safe, and backed by increasingly strong evidence. Talk to your physician before beginning any exercise program. But ask specifically about isometric protocols for blood pressure management, because it is very likely this has never come up in any of your appointments. A woman named Dorothy came to my outpatient clinic 2 years before I retired. She was 68. Her blood pressure had been elevated for 11 years. She was on 3 medications. She was terrified of a stroke because her mother and her aunt had both died from cerebrovascular events. She sat across from me and said, with complete defeat in her voice, "I am doing everything I am supposed to do. Why is it not working?" I spent 45 minutes with Dorothy. I reviewed her morning routine. I reviewed her diet timing, not just her diet content. I reviewed her sleep. I taught her the extended exhale breathing protocol. I recommended she shift her sodium timing and switch to room temperature water in the morning. I discussed bedtime dosing for one of her medications with her primary care physician. 6 months later, Dorothy came back. She had reduced from 4 blood pressure medications to 2, under her doctor's supervision, based on her consistently improved readings. Her morning systolic average had dropped from 164 to 138. She was sleeping through the night 4 nights out of 7, instead of 1 or 2. She said to me, "Why did no one tell me any of this before?" That question has stayed with me. It stays with me every time I sit down to record content like this. It stays with me when I think of Gerald and his 30 years of elevated readings and the pamphlet somebody handed him in a waiting room. It stays with me as I think about every person watching this right now who has been told their blood pressure is high and been handed a prescription without a conversation. You deserve that conversation. You deserve it now. Let me bring everything together. The 5 things we covered today. First, the extended exhale breathing technique. 4 counts in, 6 counts out, 3 minutes, once in the morning and once before bed. Targets the vagus nerve directly. Measurable reductions of 8 to 15 points in clinical studies. Second, thermal vascular constriction in the morning. Eliminate ice-cold beverages before your body has warmed up. Switch to room temperature or warm water first thing. Expect a reduction of 6 to 9 points in your morning readings within days. Third, sodium timing. Shift your highest sodium meal to the middle of the day. Drink 12 to 16 ounces of water between 4 and 6 in the evening. Give your kidneys the window they need to work. Expect reductions of 7 to 11 points in morning readings within 2 weeks. Fourth, nocturnal dipping. Protect your overnight blood pressure recovery. Consistent sleep schedule. Limited late evening fluids. Ask your doctor specifically about bedtime dosing if you are on antihypertensive medication. This single conversation could be one of the most important you have ever had. Fifth, isometric exercise. Hand grip protocols, wall sits, or plank holds, 3 days per week, backed by clinical research, accessible to almost everyone. Reductions comparable to aerobic training. Ask your doctor about the specifics. Now I have a question for you, and I want you to answer it in the comments below. Which of these 5 did your doctor never tell you about? Be specific. Tell me which one surprised you the most, and tell me which one you are going to try first. Your answer might help someone else who reads it. These comment sections become communities, and someone who needs this information tonight might find it because you took 30 seconds to share your experience. If this video gave you something useful, something you did not know before you clicked play, please share it with one person in your life who is managing blood pressure, not as a medical recommendation, as a conversation starter, as a reason for them to bring these questions to their own physician. You could be the reason someone walks into a doctor's appointment better informed than they have ever been. And if you have not subscribed yet, please do. I publish content here specifically for people over 60 who want to understand what is actually happening in their bodies, not just what to take for it, but why it is happening and what they can do about it on their own terms. Subscribe, and you will not miss what comes next. One more thing before I go. Everything I have shared today is based on published research and clinical experience. It is not a substitute for your relationship with your physician. It is not a reason to stop any medication or alter any treatment plan without your doctor's direct involvement. If your blood pressure is being managed medically, these strategies are meant to complement that management, not replace it. Bring these ideas to your doctor. Have the conversation. Ask the questions. You are allowed to ask questions. Dorothy asked them. Gerald's wife told me, after he recovered, that she wished he had asked them years earlier. It is never too late. Your heart has been working for you every single minute of your life. Give it 3 minutes of yours, starting tonight.